For years, dentists have believed these fillings were safe, but now we know that every time we chew, brush or grind our teeth, some of the mercury is released as a vapor and we inhale it. Panorama has uncovered a growing body of scientific evidence which shows ominous links between the mercury from our fillings and serious illnesses. We also reveal an uncomfortable background of complacency and ignorance within the British dental establishment and apathy in government, which is helping mask the truth about the dangers of the poison in your mouth. These men are handling old amalgam tooth fillings for recycling. Once removed, what had lived inside our mouths for years is suddenly treated as the dangerous poison it's always been. Mercury is so toxic that at certain levels it drives people mad, but even the tiniest amounts are regarded as unsafe. At lower levels, and no one quite knows how low they are, the metal attacks the brain and the central nervous system, producing symptoms which include nervousness and irritability, lack of concentration, loss of memory and self-confidence, mood swings, anxiety, depression, fatigue and insomnia. Because there can be other causes for these symptoms, no one has associated dental amalgam with them. But suddenly the familiar quicksilver of our youth is beginning to look dirty.
If you have something that's being put in your mouth that you can't dispose of in a wastebasket without breaking our environmental protection laws, there's no point in keeping it around. There's no point in taking that type of risk. There's no point in exposing people to any level of mercury toxicity if you don't have to.
Mercury is a poison. There's no safe level. The World Health Organization has determined that. And so how can we continue to implant that into people's teeth?
Dentists have been using amalgam for over a century, convinced of its safety. The mercury is used to bond silver and other metals together to make a cheap, efficient and durable filling. Yet no one has proven that when the mercury goes into our bodies that it is safe. The dentists have always assumed it was safe because there were no identifiable side effects. But dentists may not have been the right people to look for the subtle but dangerous symptoms of low-level mercury poisoning. Supposing there have been side effects, but of the kind only doctors are qualified to recognize. Has the evidence always been there? The first evidence of mercury's journey into the body came 10 years ago. Dentists had always assumed that mercury stayed inert in the filling, but scientists discovered that the gleaming new amalgam inside a polished tooth didn't stay put. It leaked as mercury vapor and entered the bloodstream. This is an electron microscope picture of a 10-year-old amalgam filling. Those black holes are where the mercury used to be. In this filling, some 40% has evaporated in only 10 years. So where did it go? And could it cause harm to humans? The challenge was taken up here in Western Canada by two men from different disciplines. Their cooperation has produced scientific revelations which are so damning that they may yet bring about the end of the very use of dental amalgam. Fritz Lorscheider and Murray Vimy set about clearing the smoke surrounding the amalgam mystery. Vimy, the academic dentist and World Health Organization consultant, and Lorscheider, professor of medical physiology at the University of Calgary. They pioneered a simple but dramatic experiment to show not only where the missing mercury went, but also that it did do harm when it got there. Their work shattered the comfortable illusion that mercury in amalgams was stable and safe.
Amalgam mercury is concentrated in the body.
They took a sheep and put fillings in its teeth containing radioactive mercury, which would show up as black on X-rays.
Here's the outline of the sheep, going all the way around. And this is the jawbone of the sheep. Here are the two stomachs. This area is the liver, and here are the two kidneys. And this is the transverse colon. So the mercury from the fillings, which was slightly radioactive, migrated to these tissues. In fact, it was in all the tissues. Now, the dental profession said that, well, it's a sheep, it chews too much, they grind a lot, they regurgitate their food. It's not a good example. Here.
So they repeated the work with monkeys and found again the mercury had spread. When you look at all the current scientific evidence, what do you think it's trying to tell you?
It tells me very succinctly that there's a chronic low-dose exposure to a toxic heavy metal, that 80 to 85% of the industrialized world has this metal implanted in their teeth, and it's a situation of timed release poisoning.
Dr. Lars Freeberg at a German amalgam conference. He's the world's leading authority on mercury poisoning and was chief advisor to the World Health Organization on mercury safety.
Controversial issue. And there's no doubt that
Until now, he's remained studiously neutral in the mercury debate.
You should try to avoid to implant toxic metals in the mouth.
Why then does an organization like the British Dental Association say that mercury is safe for everybody unless they're allergic to it?
Well, I don't know why they say it. That's impossible for me to answer.
You've written the standard textbook on the toxicology of metals, and you don't agree with them, do you?
No, I don't.
Dr. Freeberg, is there a safe level of mercury?
No, there is no safe level of mercury, and no one has actually shown that there is a safe level. And I would say mercury is a very toxic substance.
So there's no amount, in your opinion, that should really go into the body?
I would like to avoid it as far as possible.
If there is no safe level of mercury, why does the British Dental Association say there is one?
I don't know, but I think they are wrong.
Now even more ominous evidence has been uncovered, this time about the dangers of amalgam's mercury in the most vulnerable and sensitive organ of all. It was a dentist in Los Angeles who first discovered from his examination of bodies here in the mortuary that mercury from dental amalgam travels to the brain, and the more fillings, the more it accumulates. Dr. David Eggleston is a dentist in California. His clients include Tom Cruise. His less glamorous work recently took him to the county morgue to investigate the relationship between dental mercury and the brains of the dead. Eggleston spent months studying the records and discovered that mercury from amalgams not only accumulates in the brain, but some of this poison stays in the skull for as long as 40 years.
I think there is legitimate concern regarding the mercury issue in dentistry. Mercury does release from the silver fillings. It does accumulate in the body.
Do you insert mercury amalgam in this practice here?
No, I do not.
For the reasons you've just given?
Yes, for the mercury issue, yes.
And have you had your fillings, your amalgam fillings removed?
Yes, I have.
Again, for the same reason?
For concern with mercury, yes.
Sweden, the first country in the world whose parliament has banned amalgam. They've taken the dangers so seriously that amalgam's use will end within 3 years at the latest. And within 6 years, all mercury will be outlawed. People say that the only reason the Swedes are banning dental amalgam is on environmental grounds. Now, is that true?
No, really not. It's one reason, but the most important reason is, of course, of health reason.
Why has Sweden been the first country to ban dental amalgams?
We said we have seen enough. No, we have to stop it before much more people are more sick than they are today.
These are the dental records of scores of elderly nuns in a convent in Wisconsin. They may hide part of the answer to one of amalgam's greatest riddles. Is there a link between the mercury in fillings and the deadly disease of Alzheimer's? A unique study, starting with these files, may provide the clues.
13, 14. We got 14. So we made it.
These sprightly ladies have made it into a fulfilling old age. They've agreed to take part in a scientific gamble by donating their brains to medical researchers who will look for a positive relationship between dental amalgams and Alzheimer's disease.
37. 38. I pass.
And already some scientists are reaching provisional conclusions about the dangers of dental amalgams. Is there any doubt in your mind about the association between mercury and Alzheimer's?
I would not want to make the statement that mercury causes Alzheimer's disease, but there is no doubt in my mind that low levels of mercury present in the brain could cause neuronal cell death, and this could lead to dementia, which would be similar to Alzheimer's disease.
Dr. Boyd Haley, professor of medicinal and biochemistry, has just made a dramatic breakthrough while investigating the implication of dental amalgam with Alzheimer's. He's discovered that even tiny quantities of the metal can produce changes in the brain that are identical to changes caused by the disease.
As you increase the mercury concentration, this protein goes from being very abundant to very low.
Specifically, the mercury inhibits the efficiency of tubulin, a protein essential to brain cells.
We can't go inside a living human being and look at their brain, so we have to work outside and do scientific experiments such as we've done. And to the best that we can determine with these experiments, mercury is a time bomb in the brain waiting to have an effect. If it's not bothering someone when they're young, especially when they age, it could turn into something quite disastrous.
So in the worst case scenario, what happens to the human being?
You would become demented.
It's a case where both sides, believers and non-believers, are fundamentally divided on even the most basic issues. Amalgam's most vehement support comes from the British Dental Association, the professional body to which most dentists belong. They run a service which includes giving their members an up-to-date scientific advisory service.
Because there's quite a number of
John Hunt is the chief executive and Peter Gordon the scientific advisor. They do no original work, but review others' studies. Is amalgam safe?
In a word, yes.
No doubt about that at all.
No doubt about it at all.
Is there anybody it's not safe for?
There may be a small percentage of the population with an allergy to amalgam, but it really is very, very small. In fact, less than 50 worldwide in the last 100 years.
So it must be 99.99% safe.
Yes, in our opinion.
Are you aware of the association between dental mercury and Alzheimer's?
As far as I know, there is no association with mercury and Alzheimer's.
Are you aware of a paper by Dr. Boyd Haley at the University of Kentucky?
By name, no.
Gentlemen, this was published in 1993. Isn't this a document that should be on your desk?
I come back to the point that we rely on expert advice.
But what kind of advice are you getting if these papers are not being put on your desk so that you can inform your dentists and members of the public?
Well, we look to a group of people, including our consultants, but also we rely upon the Department of Health and other bodies to let us have their results and their advice about results that they would have read in papers.
These are key papers, Mr. Hunt. These are very important papers, aren't they? I mean, a relationship between dental amalgam and Alzheimer's is not an unserious matter.
No, we shall certainly look at that paper.
Could the Chief Executive of the British Dental Association reassure me? Do you accept that mercury is a toxin?
Yes.
Do you accept that it goes into our bodies and it's released from amalgam fillings?
Well, there's no real evidence that, that mercury does cause any problems in that way.
The EC, their latest document says the largest source of mercury exposure for most people in developed countries is inhalation of mercury vapour from dental amalgam. Mm-hmm. But you're saying it can't get into the body.
Well, it says exposure to mercury vapour. And mercury vapour, whilst you're having fillings done, obviously there is mercury vapour around. What I'm saying to you is that the long-lasting remaining residues of mercury aren't shown to be present in people's bodies.
Right, but the actual vapour coming off the mercury filling,
At the
are you
time
saying the BDA situation is that can only happen when the filling is put in or the filling is removed?
Yeah.
So it can't happen when you brush, it can't happen when you chew.
That's right. Yeah, but I mean, you've got to look at the quantities involved here and the significance of...
No, but you just told me it was zero.
Okay.
Well, is it
la
zero
la la
or
la
not?
la 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 la.
Is it zero or not?
No, I'm not going to do this. If you're going to try and trap me, I'm not doing it.
I'm not trapping you. You told me that there was no...
No.
You told me that there was no mercury vapour released from an amalgam filling.
No, I'm not doing this.
You're not doing what? Answering the questions that we told you we were going to ask you?
No, you didn't tell me you were going to do it that way.
Do what? What way? No. I told you it was going to be about amalgam fillings.
Yeah.
That's what we're talking about. We're talking about the safety of amalgam fillings. And your answer is?
No, I'll answer you serious questions if you're going to ask me.
That is a serious question.
No, all right, okay.
Okay, the question is,